Hello, I'm Chris Wade and I'm a speech and language therapist based over in South Wales in the UK. I don't know why I just said based instead of based. My accent is quite fluid. I'm from up north. I've lived in London. I've worked a lot abroad, all as a speech therapist. And now I'm based over in South Wales, in Caerphilly. But apart from that, or aside from that, I wanted to just talk briefly about the ADOS assessment. So the ADOS assessment is an assessment that I do probably at least one every single week. I trained up to do the ADOS when I was working for the NHS about 10 years ago. And at that point, I was doing 2 to 3 assessments every single week. And the ADOS stands for the Autism Diagnostic Observation Schedule. And there is now the ADOS 2. So I think the ADOS 2 came out about 3 years ago. I'm probably wrong with the maths, but the most recent one is the ADOS 2. And the ADOS has different modules. What I'm going to talk about is module 3 today. So module 3 is for the fluent child. It's a child that uses language. Module 3 is a module that I tend to use as an adolescent. I'd move on to module 4 with an adult if they have language. But with module 3, I'd see a lot of individuals up here where I do my assessments in the lodge. I also go to family homes or into other clinics, do the module 3. Technically with a module 3, the guidance that I was given in my training is that the individual doesn't need to have anybody else present. So you shouldn't technically have parents present in a module 3. I tend to, because I think it lowers kind of the individual's kind of potential anxiety levels and their stress levels. So, but with the module 3, you can do an ADOS in what I see is quite a formal, kind of set, quite scary manner. I'm quite informal in my approach. Whatever assessment I do, I stick to standardized guidelines in how I administer it. But I think with a module 3, for an individual that you're doing a module 3 with, they've got a kind of typical language development or typical language skills, and a big part of it is kind of a conversation. It's kind of a back and forth conversation. You're asking lots of kind of pressing questions, and therefore with the module 3, I feel it's quite important to build up a kind of a rapport as quickly as possible with that individual. And if you're formal and quite stuffy, I know I shouldn't say that, but if you are, then it can be quite difficult to build up that rapport, especially if you're working with kind of the adolescent population. So I tend to do module 3 whilst wearing t-shirt and jeans. I'm on a chair that tends to be a little bit lower than the individual, or at least on the same level. Obviously, with COVID-19, we've got kind of social distancing measures, and making sure we're kind of following the risk assessment that we've kind of set out. But with a module 3, you have to be able to build that rapport and or you have to try and build that rapport. So like I say, a big part of module 3 is asking questions and kind of building up that conversation. So some of the questions are around friendships, around marriage, around the individual's understanding of feelings, what things make them feel a particular way and how that feels inside. There's things on social annoyances, whether they feel like they've ever been picked on, and whether there's they can kind of think of from someone else's perspective as to why they might have been picked on, or things that they might do that might annoy other people. We talk about loneliness. We talk about other people's perspective on loneliness. And then there's sections on kind of, and the whole point of module 3 is we've got particular kind of social presses, so things that we're doing to see if we can get the individual to do certain things. So, for example, we might be talking about holidays. I might start the topic of holidays, and I might say, "Oh, I went on holiday," and I'm looking for a response like, "Oh, where did you go?" And if they don't respond, I'm like, "Oh, I went on holiday, and it was like a really hot location, and there was a beach there, and I went with my family." And they're like, "Okay, why is he doing that?" Or I might do the same with pets. If we're talking about pets. I'm like, "Oh, do you have any animals at your house? Do you have any pets?" And they might say, "I've got a dog, I've got a cat." So what the dog's names, and they might be like George and whatever, Peter, strange animal names. So they respond with their animal names, and then I might say, "Oh, I've got an animal, but it's not a dog or a cat." So you kind of setting up this kind of hooks to try and get them to ask you a question. The other things that we look at is kind of the use of gestures, so the type of gestures, whether they're descriptive, whether they're emphatic gestures. We look at someone's ability to kind of, without directly asking them to, but their ability to kind of describe a non-routine event and kind of give you some information. Throughout an ADOS module 3, I'm looking at how comfortable I feel as the assessor. And this is one of the scores. So it's how comfortable was the interaction? Was it mildly uncomfortable? Was it okay? Was it kind of moderately uncomfortable? Did I have to put in a lot of scaffolding to keep the conversation going? Did the conversation just freely flow from one person to the next? And if it did, is there a particular reason? Was it around a particular interest? For an individual, it might be around so for the kids that I'm assessing at the moment, it might be around topics like Roblox, could be around Harry Potter. Is there like a specific kind of highly excessive interest in that certain topic, and therefore it does go back and forth, but it's around that topic. And if you try and shift it to something else, they might struggle. The other things that we look at is their kind of language levels. So we get them to describe a picture, we get them to look through a particular, a choice of a couple of books that have very few words in them, so they're technically wordless books. Is their ability to describe the picture, describe the scenes, look at the cohesion between their sentences, look at their overall storytelling skills, look at whether they bring in emotional language. Another subtest, and kind of this is real whistle stop talk. Another subtest is a bunch of characters that they're asked to play with and create a story. How does that story flow? How do they accept my kind of going into that story and adding bits for myself, changing bits, and then stepping back out? Do they accept that? There's opportunities to see whether the individual is able to ask for help or for assistance during the ADOS. My favorite one is something where we create a story from absolutely random objects. So you take out a number of random objects, you create a story. I set a challenge for myself about 10 years ago that I wasn't going to do the same story every time, and because I want to put myself in the perspective of the individual being assessed. And therefore, with this particular subtest, I'm having an absolute mare trying to think of a story with all these items that makes sense, that has some form of cohesion, that is kind of a story that really makes sense. And I'm picking out a cork and a spring and a piece of elastic band and a ball or a car, and I'm trying to make it all make sense, because I'm showing to myself how tricky that can be to just think on the hoof. So that's one of those. So we're looking at kind of someone's language levels, but their creativity, their ability to imagine a story and come up with something. Did they just copy what I said as a model, or did they come up with something completely novel? Is there, when they're using an item such as an elastic band, is it an elastic band, or is it this is the pool, this is the world? Are they really using their imagination, or is every object a representation of itself? Other things within the ADOS, let me have a think. I think I've covered everything, or thereabouts everything in module 3. It should, from my perspective, my module 3 should flow so that when the adolescent comes into the room, the ADOS starts, and that kind of flowing from one subtest to the next and bringing out random materials and just talking through them. It should flow. It should be kind of, it shouldn't, I feel, and I mean, I'm not a trainer, but the way that I've done them, and I always have done, is there's a nice flow through the ADOS. I don't have a particular order in which I do things. I go by how the individual's kind of reacting to the different questions that I'm asking, and how we can move from one topic to the next and kind of allow that flow. One big part that I missed out is something called the break. And this is where you're going back and forth, and all of a sudden you're like, right, I'm just going to make some notes, and you sit back and you want to see how that individual then tries to engage with you. Do they engage with you? Do they just crack on with what the materials you put in front of them? Or do they want to engage with you? Do they want to tell you about what they're seeing, what they're interested in, for example, a piece of paper, a radio, etc. So that's the module 3 ADOS. As you probably realize watching these videos, it's pretty informal. I bounce from one topic to the next. If you're interested in getting ADOS trained, there is ADOS training going ahead, or ADOS 2 training going ahead via Pearson. There are other providers, and for me, it's a fantastic assessment, but it's not a diagnostic assessment that stands alone by itself. You don't do ADOS training and then have the ability to assess and diagnose autism. It is part of a multidisciplinary assessment. And I've talked about that in one of my previous videos. What I might talk about next is one of the other ADOS, or what I will talk about next at some point is some of the other ADOS modules for the younger children or for the older adults. And then I'll also look at the ADI, which is the Autism Diagnostic Interview. And there's a little R at the end, so it's ADIR, Autism Diagnostic Interview Revised. Right, I need to go back into a hearing. Hopefully people have taken something from this video. Feel free to comment, feel free to share, or to feel like a YouTuber, press that like button. Right, take care, thanks, bye.